Joyce Maple D'Souza, and I'm here with the one more new topic. Last day, we have seen many of the diseases which was related to your skin burns as well as your other infections. But have you ever observed how actually this infection is coming? What is the mode of or root of these infections are intruding into person's body? So today's topic is infection, and in this we will see what are the sources of infection, how is it is entering, or we can say chain of infection transmissions, and how we can prevent it. And this is very a basic thing which also comes for your university exam for 5 mark question. So especially those who are doing UG program, that means BSc nursing program, this particular question is asked in your microbiology also in the first year. But those who are doing in the second year for your medical surgical chapter, this is asked for 5 mark questions. And this question is usually comes for your test paper, as well as if you are lucky enough, as this is easy, there is a chance that it will come to your university exam. But most of the time, your sessional exams, this question will be there. I can completely consider as a first sessional exams. So we'll not go further more into that with sessional, who is asking what question and all. But we'll see what is infection and how it is transmitting to person to person. So, as a definition, I can say infection means the invasion. The invasion means intruding or something going inside. Okay, so invasion of microorganisms of into a person's body, or you can call as a host, and they are capable of reproducing its own diseases. So spreading diseases, multiplications, all that is possible, and that is called as infection. Something coming into the body and not causing any harm, then that is not an infection. But here something is coming and causing a disease, then it is called as infection. So whatever the pathogens or the microorganism which comes into contact with the body and causes the infection, that are called as a infectious agent. Now we'll see a very important thing, types of infection. The first one is a primary infection. Now in the primary infection, the initial infection where your infectious microorganism in a host, that means maybe in a person, maybe in a living things, or like what to say, animals or non-living things, even you can say plates or whatever the article is used in the hospital, anything you can say, it's there in the host. Okay, the infectious agent is present in the uh, directly present in one host, that is something called as primary infection. Second type of infection is reinfection. The word itself says that re means again the infection. That means the same type of microorganism is causing infection once again in the same person. Next is secondary infection. Secondary infection means a new parasite. So why we say parasite? Parasite is a one thing which comes and lives in one host and absorbs all the nutrition and causes disease. So here what happens, one new parasite is coming to the host, and this host is already infected with the some other infection previously, and his immunity is low, then we can call as secondary infection. So this is not a reinfection. In a reinfection, the same type of disease and these microorganisms are coming and attack to the same person. Now here what I am telling in a secondary infection is, there is a new parasite is coming, which is coming in contact with the person who had already or previously one last infection, and his resistant power is low. Next is focal infection. The word focal means it is in one residence. Okay, so in one place. So in case the infection is localized, it is into the one part of the body, it is not spreading systemic infection, the whole body, it won't go. So such type of infection is called as focal infection. An example can be given as appendicitis, or your tonsils may be getting infection and called tonsillitis, and the general effects are produced. Okay, they may also show the symptoms, they also show the discomfortability, fever, everything. But the thing is that the infection is not spread to the whole over body. Next is cross infection. So cross infection means from one person there is a chance that another person will also get a infection, but the another person who is already having one infection, another new infection is coming to him by from passing somewhere else to him. So that is something called as cross infection. You can take many of the examples, especially a hospital acquired infection also itself. We can take the patient is already suffering from one disease or infection, and due to some of the hospital instruments can cause one more new infection, especially your streptococcus and all. So that infection can come to him, and that type of things are called as cross infection. Nosocomial infection, specifically it is related to the healthcare workers, because the this type of infections are spread or occurring in the hospital, because there in case the one patient who had his diseases, everything, and he will be using many of the utensils, or I can say what, bed pans, or your many of the articles in your nursing unit or from nurse's station. That is a work. We cannot tell that we cannot give this care or we cannot use this instrument to the such person. Once the person or the patient is discharged, it is the nurse's responsibility that all the things should get sterilized. What happens in case of mal or indeficiency, or I can say that improper handling of the articles, or they are not sterilized properly, or negligence of any of the healthcare workers makes this a new patient. When the new patient is coming to the same room, there is a chance that they can come contact with the same instruments, and the infectious organs is still present there, which will acquire his body. So this is a type of infection is called as nosocomial infection. Next is iatrogenic infections. This is also a type of infection which is occurring in the hospital. Now here especially the healthcare workers also a source of infection. Maybe a simple thing, the what to say, I can see their gown which they are wearing when they are coming into contact with one more person or two more patients, there is a chance of spreading infection, as well as the articles which is used for therapeutic use, your endoscopes, or any other investigation or any other procedures can cause the infection to that person is called as iatrogenic infections. Next is endogenous infection. Now, the word endogenous infection means the infection occurs or within the body, the person is carrying its own infection. Okay, so it is occurring due to the pathogen which is already present in the body. That kind of infection is called as endogenous infections. Exogenous infection, the exactly opposite to the endogenous. That means the microorganisms or the pathogen which is coming from external forces. So external forces you can take into the any number of the forces, maybe the persons, other patients, other utensils, or other materials, or investigations problems other than the hospital, environmental problems when the person goes in the bus or public transport. Anything can cause infection. Environmental factors also can cause the infection. So all the things we can together be called as external sources. And in case the external source is giving infection, this is called as exogenous infections. Next is subclinical or inapparent infections. So the word subclinical you would have heard in the first year of your UG or BSc. There is something called as iceberg phenomenon. That means the piece of ice which was floating inside the water is so much big, and the outside only small piece of ice is seen. That means the disease which is there inside is having so much deep and intense causing disease, but when outside it does not show much features, very less amount of features actually. So that's why the part which is under the water, especially in the eyes, that are called as subclinical. That means clinically there is no symptoms, that they are not aware. A piece of ice which is floating only seen outside, which is dipped inside is not visible. Same thing happens with the disease. Whatever the person's body is exhibiting, that symptoms is many maybe minor, but inside the body which is not seen, some symptoms are appearing or the disease is intensely affecting, that things are called as subclinical. Now here what is the subclinical infection means? There is an infection but whose clinical features are not seen outside. Next is atypical infections. That means his symptoms are, that means that particular infectious diseases symptoms are atypical. What is this by atypical? That means A means completely, like eating, that there are several type of infection. Each one is showing so many type of symptoms. But here atypical is some of the first type of disease symptoms also there, second type of also there, third types of diseases symptoms also there. That means it is a mixture of the all the other things. Not everything. From the first disease fever is there, second disease rashes is there, third disease redness is there, fourth disease erythema is there. So think that there are several type of diseases infection, and out of this some clinical features it will select, and there is one more disease. So I cannot put this type of disorder into first, second, third or fourth. That's why I can say this is a atypical one, not a type of anything, not a typically I can consider as any of this. This is one more new one where I cannot put into any of the standardized things. So mixture of so many disorders, but it involves many symptoms of many diseases. So this is something called as atypical infection. Next is a latent infection. You would have heard about this latent phase, lag phase, log phase, everything. So now in latent phase, what happens? It remains calm. That means the infections or organism which is there inside the human host, it will survive very nicely until when the host immunity is low. Okay, when my immunity goes low, suddenly this will get active and cause the infection, and they will form a new diseases. So surviving until the host immunity, otherwise resistant power is low, then they will show the many symptoms. So such type of infection is called latent infections. Bacteremia, this is also one type of infection. Now here what happens? Bacteremia means bacteria inside the blood. That will cause the bacteremia, especially when there is a hematogenous infections. That means any part of the body that gets infected and this infection is passing through the blood, then obviously blood will have bacteria. That is called bacteremia. Next is septicemia. So the same like as a bacteremia, that means the infection spreads into the your blood streams. Okay, so the entry of the organisms into the bloodstream, and then it will go into the whole body and multiply. That is something called as septicemia. Next is toxemia. Now here the word toxemia means toxin means poisonous. Emia is also blood, I already told. So hemo is the blood, and toxemia is a something poisons. Now what happens when these organisms produce some of the toxin substances to the body? Then it is called as a toxemia. It implies a concentrations of bacterial toxins in the blood. So there come we are finishing the types of infection. Now very important stages of infection. Stages of infection is also asked in your microbiology exams. Now we'll see each one step. First one is incubation period. Now incubation period means the first step incubation period means the word incubating, you know that some people are doing culture and they keep for the proper what to say temperature, light, and certain time itself it will show or it will grow. Now same thing happens here. Incubation means the organism which is coming and sitting into the host place, and the time taken the time taken to entry and show the first sign. And now we'll take an example of your fever. Okay, the before fever comes, so many symptoms are appearing, right? So think that one of the bacteria or viral virus came, and now first it will starting to make a symptoms called throat itching. Okay, so the time from entry to the first sign is called as incubation period. Next is prodromal stage. Now here prodromal stage means that many of the symptoms will exhibit. Okay, maybe think that your fever itself, you will be having a throat itching, you will be having a ear itching, you will be having a throat pain, dysphagia, redness of the throat, otherwise symptoms of your tonsils, uh, eyes burning, redness of the eyes, headache, all that things will be there. All of things in between, you will be having fatigue. So there are so many general features are showing, and in this, when this prodromal phase is coming, there is much more clinical features which is specific one it will show. So example I can say, as I said, diagnosis of fever, the specific clinical features are your increased body temperature. So when there are general symptoms are there and suddenly there are specific features is shown by the host, which we can give a correct diagnosis. Yeah, yes, it is a fever. Such phase is called as prodromal stage. Next is illness stage. The word itself says that there is a exhibiting of illness. Here what happens? The exact features are came. Now they will be showing the infection. Maybe the increased temperature, sinusitis, cold, congestion, breathlessness, all these things, breathing problems, all that things are caused at this stage is called as illness stage. Next comes convalescence phase. Here what happens, convalescence phase means the whatever the symptoms which is there, one by it will disappears. And once it is disappeared, there is a recovery is take place. Maybe your throat itching went, your sore throat went, dysphagia went, eyes burning went. So one by it is disappearing and body is recovering. That phase is called convalescence phase. Next is various types of agents. Now, from that time, I am telling bacteria. Is it only the bacteria which is called as microorganisms? No. There are other types of various agents are there. So that is your bacteria, fungi, virus, and protozoa. These all type of microorganism can cause the infection. Next, we will see chain of infection. Very important, so that you will be knowing that how actually the infection is appearing somewhere else and it is coming into the body. So this is chain of infection is showing you the phenomena of developing infection, the manner, the way, the route it is showing. So there is a beautiful picture which is given. I'll explain one step at a time. So first we will list out what and all things are there. It is including infectious agent, reservoir, and port of exits, as well as mode of transmissions, then port of entry, then suspectable host. So the beautiful picture which is I'm showing here also gives an idea about the infectious agent, how the reservoir, your port of exit and transmission, then entry, then suspectable. So each one I'll explain once again. So first we will see infectious agent. So from the beginning I'm telling microorganism, all that are so and so things. So now this is a thing where infectious agent means the microbial agents which are capable to give or produce or cause any type of diseases is called as infectious agent. Now it can be a virus, bacteria, fungi, protozoa, anything. Reservoir. So the word itself is the reserving, and that means it is a place where your microorganisms sit, they live, they thrive, and they are able to reproduce in that place is called as reservoir place. Reservoir can occur at any place. For example, I can say it may be in any of the human body, it may be in the animals, the pets which we are carrying, it may be the any utensils, tables, spoons, etc. Now, port of exist. The word exist means living. Now, where this microorganism is living and going, the place is called from the reservoir. It is existing and going into the person or the host is called as the port of exist. Now, think that from where, which places this will exist, especially once it is came into the body. Now there are anatomical orifices, that means holes, openings are there, maybe mouth, nose, ears or something. So now this natural orifice or by your coughing, sneezing, automatically the microorganism is there which is there in the body, it will come out. Maybe the uh, even your touch. I said a tablespoon also is having microorganism. When you're touching, there is a chance that that will come. So somehow the from the reservoir, the bacteria or any other microorganisms are existing. That is called as existing means coming out. Then it is something called as port of exist. Next is mode of transmission. So the word itself it is there. Transmission means from one place to another place it is going. Now here what happens, the transmission usually occurs and the mode is called the channel, the way it is taking from one place to another. So how it is moved or carried, it may be the specifically you can say in hospital, healthcare workers are one person who carries the infection from one place to another place. But it doesn't mean that always the healthcare worker, but there is a chance that when you are in the outside the hospital, environmental factors, as I said, public transport, all that can also is a channel or your mode of transmissions. Now, port of entry. So think that as the port of it is existed, that exist means went out at the same place when it is entering into the new person, there is called as port of entry. So it also will enter to the other body. Okay, it is maybe because of any cuts in the other host, that means new person, otherwise by their anatomical openings, orifice also, it will go inside. Now this port, otherwise, other than the cuts, otherwise your anatomical orifice, one more thing is that whatever the tubes which we are using during the treatment, example is catheter, that also can cause the infection as well as port of infection or port of entry, where it furtherly can cause something called as COTI, that means catheter associated urinary tract infection. Next is suspectible host. The word suspectible means there is a high chance, or who is getting more risk or having more potential risk to get the infection, whose resistance power to fight against the any pathogen is low. So resisting capacity don't come. Resisting means stopping, not to come. The capacity is lower for them. It will be more chance to get high infection, and that kind of person or the any animals or any object, living things which is causing infection, for which it is causing infection, is called susceptible host. In addition to that, like whose immunity is low, there are person who's getting immunosuppressant drugs, otherwise some disorders like maybe HIV, cancers. They are also in a what to say in a more chance of getting all the infectious, as well as, like as I said, older people and your children. So children are the one who is not got or developed their immunity, that's why they are prone to get infection. At the same time, older people who is already having weak immune system, they will also get. And third one is, like as I said, immunosuppressants. Otherwise, those who are having any diseases like cancer and HIV, they can also get the diseases. Especially infectious diseases, they are more having high chance to get. They are susceptible host. Now, what are all the factors which is making person to susceptible host? One I told, the immunity. Another is age, as from the childhood it is not developed, or in the old age it is weak. Physically and psychologically, those who are having any problems, physical disorders, if they are having, as I said, AIDS and HIV, as well as their psychological well-being also can make them to get infectious disease. If the person who is not well psychologically, he is also prone to get infection. Now, mode of transmission, it is important that how it is carrying. So first one is contact transmissions. So the contact transmission means by your touch. Okay, when somebody is giving handshake, there is a chance that there is a contact transmission. A contact means touch. So especially think about the person who does not wear the mask or does not use the kerchief when sneezing. They uses their hand, and the same hand if they use the used to shake or they hold in public transport, and another person will use the same places to hold in the public transport or the shake hands with others, can cause a transmission of infection can come to him, and this is called as contact transmission. Second is droplet infection. Here means you sneeze or cough in the environment, it will be there in the environment, and the person who is having less immunity, they are coming across with the same type of infection, into that area, they will get the infection. Especially, I can say many of the nurses who were working in the ICU during the COVID time, and when their immunity was less, they were used to get the COVID from the patient, okay, whose immunity was less. And it is because of the droplet infection. The COVID patient who was having cold fever, when they cough, sneeze, everything, is a chance. Same thing happens with this, many of the disorder, maybe the tuberculosis or any other disorder. The infection, they will be spread in the air and through droplet. Okay, or just by sneezing, if they are nearby, it will go. So that is droplet infection. Same things which is connected to the third one, airborne infection. That means the person is sneezed and the small particles and heavy particles will be there in the sneezing. Heavy particles will fall down, small particles will go in the air, and that can cause airborne transmissions. Vector transmission means some of the organisms which is carrying the diseases, which I can say example is your mosquito-borne disorders, your malaria, otherwise filariasis. These are type of the disorder which can cause, we are called as a vector transmission disorders. One more transmission is your vehicle transmissions. That means maybe the non-living things are spreading infection. Maybe your bedpans or the bed sheet or the coat of healthcare workers or the family members who is coming in contact with the infectious person at home. All that can cause the your vehicle of transmission. That means any object, non-living things which is carrying the infection from one place to another place. So a beautiful picture is given where it is explaining the whole chain of reaction. So you can see the first there is a germs they were telling, that means your infectious agent. It may be the bacteria, viral, protozoa or your parasitic infection where it is leaving, that is called as reservoir. Maybe in the food, soil, water or any of the people or animal, that is called as reservoir. And they are how it is getting out. So it can be get out, or you can say port of exist. It can be the cut through mouth, sneezing, coughing, anything. Then there is a germs get around. That means the mode of transmission. So we already told that there is so many type. Maybe the contact, maybe the airborne, there is vector borne, vehicle borne. Somehow it is going to another place. Then comes your mode of entry. So it also can be because of your cuts or whatever the natural anatomical orifice is there, or if you are immune suppressant person, resistance is low, then you can get the diseases. And the last one is the suspectable host. That means the next sick person will get. These are maybe because of the babies, children's or elderly, they are prone to get, otherwise people who is having less immune system. So whole chain of reactions, or I can say whole chain of spreading infection is explained in one picture. If you go through this, you are like very easy to remember how the infectious agent reservoirs. A particular names you have to remember, the steps you have to remember, and you can write very well in the exam. Now, infectious control as well as prevention. According to the WHO, otherwise there are so many organizations, WHO as well as control of diseases, disease control and prevention organizations are there, which gives certain guidelines to prevent the infection in the hospital as well as outside. So especially your WHO or the CDC, that means your disease control as well as prevention things are giving, they are reporting the many of the significant cases which is outbreaking, or some of the environmental hazards which is happening and causing the public health problems. Now, what is this thing is the in the especially in the healthcare sectors, when the nurses, when they also serves an important role when they come across to the patient, they are having high chances of spreading the infection because there are many of the infectious patients, and we go to all the patients. So that's why specifically in the ICU they give 1:1, as well as there are so many workload, that too is an considering part. But 1:1 giving in a particular ICU is also good because they won't be carrying the infection of one person and can spread to another one. Now, prevention of infection can be done in the hospital with the mainly three ways. So, out of which one is first isolating precaution. An isolating precaution is divided into two. One is standardized precaution, another is transmission based precaution. Now, standardized precaution. What are the standardized things which we are following in our hospital? Maybe the hand hygiene, glove using, prevention of needle stick injuries, otherwise something called as avoidance of splash and or spraying off. Okay, so all these are avoided. We maintain hand hygiene. We use sterilium to rub and clean in case we are not able to wash the hands. So between the procedure, before the touching and after touching the patient, you should wash the hands. So these are the general safety measurements. Next is transmission based precautions. Now, Here, transmission, as I said, airborne, droplet, or your vector-borne or contact, all these things also can be prevented, isn't it? You can advise them to use the mask. You can advise them to use the glove. You can advise them to use the kerchief, not to sneeze, anything. So this is one type where your standard measures are at one side. Another side, transport mode also can be, such type of precaution also can be taken to prevent the infection. Now, specific organisms will cause or potential to cause hospital acquired infections. Okay, HAI. Specifically, when there is a long time duration to keep your urinary catheter, long time NG tube is kept, or urinary bag has not changed. Ventilated associated infections and pneumonia also can occur. Catheter associated UTI can also occur. So, what happens? Even your cannula, if it is kept for a prolonged time, also the patient can develop the infection. So, there are specific organisms which will cause the infection, and when the patient is there in the hospital due to these all, whatever the I said, cannula, catheter, ventilators, otherwise your any of the treatment procedure causes the infection. The example of these organisms are something called as Clostridium, as well as methicillin resistant Streptococcus aureus, then vancomycin resistant Enterococcus, and multi resistance organisms. So the word itself is so much complicated, as well as to treat it is very complicated, because a simple antibiotics or simple antiviral drugs may not work on it. There is multi-drug resistant capacity organisms are there. So, because so many patients and so many instrument, and it is kept artificial, any instrument is kept inside the body can cause the infection. That is true, and this is happens when negligence of healthcare workers are happening. So, what to do with these type of infection? There is a highly precautions are taken, highly standard guidelines are given by WHO as well as CDCs. It has to be followed, as it is very difficult to treat. Preventing healthcare associated bloodstream infection, that's especially your bacteremia, septicemia, or fungalemia. So, out of which the first one, the preventing infection even in the community also can be done. How? First one is vaccination program. So, reporting what are the problems with the vaccines. Contraindication to the vaccine also has to be taught to the everyone, as well healthcare workers as well as to the general public. Then common vaccines, maybe your MMR, your varicella, zoster, influenza, and human papilloma virus. This has to be given to the person. Prevention also can be done by planning for any pandemic. So, okay, pandemic you can take example like a COVID. Some of the disorders are there which is all over spread, and I cannot completely say the pandemic or endemic diseases. It was there for a all over world. The whole world was suffering with this. And planning for such infection was particular different hospitals were established. But here I cannot establish one new hospital. There are the like a PPE kit can be used. All the mask or your eye shield, cap, gown, everything can be used for your safety. Reduce the risk for the patient. It may be because of any, especially at home, okay, home based preventing infection. Then infection is there for the patient and it can spread to the family members. Infection there is for the patient, it itself can be become into worsening condition. So we have to take care of all the equipments care which is used by the patient, as well as patient himself should get some education what is happening with him and why he himself can, or what are the things which he can take action to prevent all these measures he can take, and educate the patient regarding like in case of absence of family members what he can do it. Reducing the risk for household members. So it is also one more thing where the patient's family members are going on contacting with him. They are coming in such a way that at home especially there is no much more safety precaution like hospital. But while educating to the family members, it can be make a considerable point. Otherwise, important point that you counsel and educate that patient's family members, so that they will not get that infection. It happened during the COVID, right? Isn't it? Family members got the COVID, and how other family members have taken care of them, isolating in a particular room which is having its own washrooms and all. They were not able to come out from that room until for the 14 to 16 days, and the food was supplied for them and specific plates and all kept for them itself. But it was not told that plates and all cannot be used by others, but they were keeping separate things for the patient until they were recovering till 14 days. So, reducing the risk to the family members also can be educated by the nurse. Now, nursing management, assessment. The nursing assessment is very important. So, whenever the person's body is getting infection, first symptom is that he will fight against with that foreign bodies, and during that they will show the some symptoms like a fever or increased body temperature, inflammation, redness of the body, headache, and eyes burning. This is shown by the patient when he is fighting against the any of the organisms. So this is has to be assessed by the nurse. Then other nursing interventions are like preventing the infections. All the modes of transmissions we know: airborne, vector-borne, vehicle-borne, contacts or droplets, infection, everything. So prevention can be taught. Then educating about the infectious process, from how the agent is existing the reservoir and entering into the suspectable host. Everything can be explained by the nurse. Other interventions are that nurse can also monitor or control the fever or any other symptom is coming. Plus, it also can monitor and manage the further complications. So, whatever the symptom presenting has to be treated. Furthermore, complication also should not come. This is also comes under nurse's responsibility. So, friends, hereby I am concluding my topic where I have told about the infectious, types of infections, mode of transmission, chain of infection, and how to prevent it. So I'll come with one more video in my next session. Till then, thank you. Bye.